Hello, my name is Madlain Arabo, and I have chosen for the Community Health Report to focus on immigrant families. This topic, this population, I hold very near and dear to my heart because I experienced it firsthand. My parents are immigrants to the United States. They came here in the late 70s, very abruptly from Iraq. They lived a very comfortable life there, and one night, my father and my grandfather got arrested for a crime that they did not commit, however, was done on their property for their business. And so they were held responsible for it. And after 3 days of being held, once they were released, they picked up and they moved here. And I first was a firsthand witness to everything that my family had to go through, from assimilating to a new culture, from learning a new language. Thankfully, my father was already fluent in English, and so we were a little more privileged than most that do immigrate to the country, but there was a lot of struggle that was there. We were also very fortunate to have some family already living here at the time, so they were able to help anchor us here, but that isn't the case for so many. And so I've always had this concern for families like mine because we're a dime a dozen. And while we were fortunate, I really wanted the opportunity and wanted to use this opportunity to see what are we able to provide these other families who might not be as fortunate. And so with this target population in mind, the mental health agency that I found was the Family Health Centers of San Diego. They offer culturally and linguistically appropriate healthcare and support services for refugee and immigrant communities in San Diego. And they're able to support refugees within the first 90 days of their arrival to the United States. They're a 501c3 private nonprofit network community of clinics throughout the nation. Most of their funding comes from Title X. They're Title X funded, they are donation based, and they have a number of different funds in place for those specific projects, in addition to fundraisers that they do. So some of the different funds that they currently have in place, they have a baby boutique fund, which is a program founded to encourage new and expectant moms to follow through postpartum care, along with providing infant health education, teaches them basic infant care. And they take monetary donations as well as gently used or new baby items, which can be very, very helpful. There are some that like donating financial assets, so mutual fund transfers, stock, or other asset transfers. They have a fund for homeless services. A lot of their clinics are usually located within partner transitional housing programs and organizations that focus on veterans, youth, and families. And they're able to provide a number of services for the homeless community that they interact with. Everything from HIV and hepatitis services to dental services to insurance benefits and enrollment, mental health services, outreach, engagement, case management. The list really goes on and on. They also have mobile medical units, which are mobile clinics that provide care for uninsured and medically underserved children, teens, and adults. And this is in collaboration with elementary schools and community centers. I thought this was really cool because one of the big reasons why so many of these families might not seek these resources is they don't have a method of transportation to even get there, or the funds to call a Lyft or an Uber, or even get on the bus or something. And so this agency has taken that issue and addressed it by being able to provide these mobile units that come to you. And so it's another way to ensure, especially that these children and teens are getting the medical help that they need. There are also sponsorships and vehicle donations, and they even have a reach out and read program that gives books to families that have children from birth up until the age of 5 to help encourage literacy. Maybe encourage was the wrong word, to help provide a tool and a resource for them to be able to assimilate to this new culture and this new country with its own language. All of this material is available through this agency in both English and Spanish. And they are able to, they themselves also provide services for immigrant families as well. Urgent care, primary care, programs for all-inclusive care for the elderly, insurance enrollment assistance, refugee healthcare services, pharmacy, medical health services, dental services, and vision services. With all of these services, they're able to provide care for over 227,000 patients every year, of whom 91% are low income and 29% are uninsured. Also, as a Title X funded provider of comprehensive sexual and reproductive health care, they provide services for over 42,000 unique patients every year. And they're only one service, one agency, which I think is incredible for the work that they're doing, especially considering they've been around for, I think they said 50 years, so a few decades. But for the amount that they're able to provide, I think that's really, really incredible. So there are other additional community resources to help immigrant families as well. When it comes to, for example, social services, there are a number of specific charities and nonprofits set up to meet the needs for those specific people within their specific demographic. For example, there's citizenship and immigration services that are basically the Welcome to the United States handbook. It guides them, gives them practical information about how to find a place to live, how to get a social security card, how to open up a bank account, how the government works. And this publication is available in 14 different languages and is revised and updated consistently. You also have other agencies like Catholic Charities. The Catholic Charities of the Catholic Charities belong to the Diocese of San Diego, provide immigrant services that foster family reunification, empowerment, and social integration by providing low-cost immigration services to whoever is eligible. You have Jewish Family Services, which is a client-centered, impact-driven organization working to build a stronger, healthier, more resilient San Diego. They're able to provide immigration service programs committed to providing low-cost immigration services to all of San Diego. They help with citizenship and naturalization, placement of green cards, travel documents, reunification. You have Somali Family Services who do the same. They help Somali and other African families in becoming responsible, independent, contributing members of San Diego through the programs that promote health, educational, and economic success and leadership efforts. You have the San Diego Chinese Center that provides cultural programs and charitable services for their community. You have the Chaldean Middle Eastern Social Services, which assists the refugee communities to facilitate their acculturation into the American society. They educate and empower to help resettle Chaldean and Middle Eastern refugees by providing them with primary healthcare, education, and social services. You have immigration centers for women and children. You have the Horn of Africa, the Chicano Federation, the Irish Outreach of San Diego, the Nile Sisters. We have so many different nonprofits out here that are those are just available for aiding in social services. A lot of them will focus on their specific demographics. However, a lot of them are also open to just anybody, whether, Catholic Charities is open to anybody, whether you are Catholic or not. If you are eligible based off of whatever requirements that they have, regardless of what your belief system is, they're able to help you. And I think that that's a really beautiful thing that we have among all of these various nonprofits aiding in providing social services to immigrant families. We also have resources for employment opportunities. We have other nonprofits within San Diego that help immigrant family members or just immigrants in general find employment. So you have Go Staff, you have the San Diego Workforce Partnership, the Center for Employment Training, San Diego Futures Foundation, Homestart Financial Opportunity Centers. We have so many different resources there as well. And this is just naming a small handful of what I had researched. And we also have housing assistance. There are a number of programs and commissions out here that help newly immigrated families find housing. San Diego Housing Commission, Section 8 Rental Assistance Program, San Diego Interfaith Housing Foundation, California Low Income Housing. There are so many services and resources out here, which made me really happy to see. But there are also things that keep this population from accessing those resources. And it could be a number of different things. It could just be that it's a different system at play. A lot of these immigrants come to this country from their country of origin more often than not, and they're, raised into that culture, raised into those processes. So being uprooted and having to come somewhere else, whether it was planned or not, is very jarring. That's not to mention a lot of, if they're escaping war, if they're escaping any sort of unrest over there, they've seen so many atrocities that we have no way to even begin to comprehend. A lot of them have lost family members along the way. A lot of them have lost parts of themselves, have lost limbs, have lost eyesight, have lost so much. And by the time they even get here, there's so much trauma there that it's hard for them to even function. So something as simple as the different process and the different system, it's just the fact that it's different compared to where they're coming from is a reason why I think members of the immigrant population wouldn't go seeking these resources. Even if it's something as simple as what forms to fill out, going to which agency, going to the DMV for this, or going to, going somewhere else to get your social security card somewhere else, or whatever the case may be. It seems very daunting and it seems very overwhelming, and that in and of itself could be a hindrance as to why some of these resources aren't being used. You also have the very real reality of they may have had to flee in the middle of the night and they didn't bring enough money. A lot of these processes take time and take money, and a lot of times some of these families don't have that, and so they need to come to find a job. But if they can't find a job, then you have other factors at play. You also have language barriers. There are so many people that aren't able to communicate with the English language effectively, and if they don't have someone here to help anchor them, to help translate for them, or whatever the case may be, they get lost in the language. And what are we able to do for them then? Even in the agency that I initially began speaking about, they only provided information in Spanish and in English. What about Mandarin? What about Arabic? What about Hebrew? What about Aramaic? What about Italian? What about these other languages where we have these immigrants also coming to this country that need these same services? And for some people, one of the reasons that they don't access these resources, what might prevent them from getting the help that they need, is just this culture shock. I know I can speak on behalf of my own culture. Like I said, I'm a Chaldean woman, I'm a Middle Eastern woman, first generation American. But even for my culture, up until the last 5 years, seeking any sort of mental health service was seen as very taboo. And even now it still is at times. So being able to go and ask for help is seen as a weakness. And you're stigmatized and you're labeled within your own community. And if you're leaving one country and coming to a new country where you don't know the language, you don't know the customs, but you find members of your community, and then in asking for resources to further help you are further stigmatized by those members of your community, it's very isolating. And so some people just don't ask for help with the resources we're able to provide. And while I think that I was personally really impressed by the agency that I had found and by the different services that I've listed in this, part of me is still a little disheartened. I'm impressed by it, but this is coming from someone who is privileged enough to be fluent in the language in which they're presenting their information. This is coming from someone who has access to the internet, who has access to technology, and who knows where to look. Like I said earlier, if you have someone here that speaks the language, so say the immigrant family or the immigrant themselves cannot speak the language, but you have someone here that can help translate, that's massive and that's so huge. It's bigger than I can even describe. But I think it's important to remember that a majority of these immigrant families are coming here without those privileges. And so, how do they have access to these same resources? I'm not entirely sure. Um, I think it'd be unique based off of each individual's um, access and their knowledge and what they're coming with. However, I'm not entirely sure what could be done to fix the issue in what do we do to help the people that don't have someone to anchor them, that don't speak the language, that don't have transportation, that don't have the internet to even look this up. How do we reach them? I'm not entirely sure. And I'm curious to see how agencies like the ones I've listed or those similar will adapt to meeting those needs of those immigrant families moving to the United States, especially because a lot of times they're moving here for a brighter future, if not for themselves, for their children.